shocking information for all. In a move that is certain to provide relief to many suffering households, President Biden recently made a historic statement that will have a significant impact on millions of Americans. The administration has unveiled plans. This isn't just your average stimulus, but a $2,000 stimulus check payment is slated to be made on June 28th. It is expressly intended for people who receive Social Security, SSI, SSDI, and VIA payments. Greetings from Updates Area, your reliable resource for the most recent information about Social Security and the fourth stimulus, which is intended for older citizens in America and includes SSI, SSDI, and VIA beneficiaries. I hope everyone is doing well. Let's get started by delving into the specifics of this historic choice. Get ready and pay attention because we're going to break everything down. It's important to know who qualifies, how the payments will be allocated, and what actions you need to take to guarantee you receive your check. You must be aware of this revolutionary stimulus package. Let's start by discussing eligibility. This stimulus is targeted at some of the most vulnerable groups in our society, those who depend on government assistance programs. People must be permanent residents of the United States with a valid Social Security number in order to be eligible. While there may be income requirements, the government is currently working out the specifics as the deadline approaches. Potential beneficiaries must make sure that their banking and contact details are current with the appropriate authorities prior to the distribution date. This will guarantee a seamless and prompt payment procedure. Now, let's have a look at explains the implications of this for various beneficiary groups receiving Social Security retirement payments, many of whom are on fixed incomes. This $2,000 might be a true lifesaver, as it could pay for necessary bills that have been. This stimulus might have a very big impact on SSI beneficiaries, who are frequently among the most financially vulnerable members of our society. It could also pile up or offer an opportunity to build up that emergency savings fund that's been running low. On their quality of life, it may make it possible for them to buy necessities that have been out of reach or assist in clearing debt that has been looming large. SSDI recipients who often have chronic medical veterans may find this stimulus especially beneficial in paying for medical bills or purchasing necessary adapted equipment. Additionally, we should not overlook the $2,000 that our veterans get in benefits. This money might be used for a variety of needs, including healthcare. Necessary upgrades to the house. Although the stimulus check is a gesture honoring their service and sacrifices and giving them a cash boost when they need it most, the consequences transcend well beyond personal gains from an economic standpoint. The introduction. It is anticipated that this $22,000 payout would have substantial ripple effects on a personal and national level. Consumer spending is likely to rise, which might provide local economies a much-needed boost. Some beneficiaries could give debt priority, reduction or savings enhancing their overall financial health. Some businesses, including home improvement and retail healthcare, may experience greater activity as a result of this cash infusion, but things won't be easy for economists. Keeping a careful watch on any inflationary pressures that may result from this large inflow of cash into the economy, striking the right balance between preserving economic stability and delivering the assistance that is required. The political backdrop of this declaration is similarly. It's interesting to think about how important bipartisan support for the stimulus will be to its successful implementation. The timing of this news may have an impact on how voters feel about future elections. This action may establish a standard for later economic initiatives and will surely be taken into consideration in the ongoing discussions over federal expenditure and deficit reduction. The political fallout from this choice will probably not stop in the upcoming months, perhaps influencing the narrative about social welfare and economic IC guidelines. This most recent payment, which focuses on particular beneficiary groups, is a more focused strategy than a wide-ranging distribution when compared to earlier stimulus programs in the United States and abroad. Despite the overall positive feedback, this technique represents an emerging knowledge of how to efficiently offer financial help to those most in need. The announcement of the stimulus check is not without its difficulties. Critiques concerns over the sources of funding have been voiced, and the effect on the debt of the country. The appropriateness of focusing on certain groups as opposed to a wider distribution is still up for discussion. Concerns have also been raised regarding possible administrative difficulties in precisely locating and contacting every qualified beneficiary. As concerns about potential inflationary effects or fostering a reliance on government assistance, transparently addressing these issues will be essential to preserving public support and guaranteeing a smooth implementation process for individuals anticipating the stimulus check. Vital to confirm personal data, keep up with official notifications, and schedule the usage of cash in advance. However, it's also critical to be alert of possible scammers. Unfortunately, times like this frequently attract individuals who would take advantage of others in search of getting financial guidance when necessary is also a smart choice. Those that are proactive and knowledgeable may make the most of this income advantage. In addition, concerns over the stimulus check's long-term effects are raised by social welfare programs in the United States. This may lead to a review of the current benefit arrangements and conversations regarding the suitability of the current support networks. In the long run, this could result in more extensive reforms as we consider the future. It is evident that the effects of this $2,000 stimulus check will go much beyond the short-term financial assistance it offers. Rather, it signals a change in the way the government views providing economic help to particular groups of people. Using a tailored approach to stimulus distribution might create a model for future economic interventions that could change how social welfare programs are distributed in the U.S. The durability of such focused initiatives will be one of the most important factors going forward. Stimulus plans. Policymakers and economists will be keenly observing the consequences of this $2,000 payment, which offers interim respite, but also raises concerns about the long-term financial security of Social Security, SSDI, and beneficiaries. Stimulation to assess if these programs should include such interventions more frequently, or whether structural adjustments are required to solve the persistent financial difficulties these communities confront. The stimulus check also highlights the more general. This campaign addresses the disproportionate impact of economic issues on particular groups in society by focusing on users of federal benefit programs, many of whom are among the most financially disadvantaged in the country. The goal is to reduce income disparity in the United States sections of the populace. This realization may result in future efforts to alleviate income inequality being more focused and nuanced. It's also vital to take into account any potential knock-on effects for other social programs and policies. The success or failure of this stimulus distribution might affect choices concerning other government aid, such as housing subsidies or food assistance programs. It might also force a review of the relationships between different social safety net programs and whether there are chances to improve efficiency or integration. Attention should also be paid to the technology infrastructure needed to deliver these payments safely and effectively. This enormous undertaking will put several government departments and financial organizations to the test, and any triumphs or failures will be measured. The financial relief offered by the stimulus might, from the standpoint of public health, inspire future improvements and how benefits are dispersed, perhaps resulting in more streamlined and user-friendly procedures for all forms of government payments. Have important but indirect effects. Reducing financial stress might potentially improve overall health outcomes, since it is well known to be a contributing factor to a number of health concerns, especially in older adults and individuals with disabilities. The stimulus check also raises intriguing issues about how retirement and disability support may change in the 21st century due to rising life expectancies and shifting workforce dynamics, which might ultimately save beneficiaries' healthcare costs. It could be necessary to reevaluate the established retirement and disability benefit structures. In a period of rapid technological and economic advancement, this stimulus might act as a catalyst for more extensive conversations on how society supports its elderly and handicapped people. Shift on a global scale. Other nations facing comparable economic difficulties may refer to the United States' approach to this stimulus when deciding on their own assistance measures, which might potentially have an impact on worldwide tendency in economic stimulus plans and social welfare initiatives. Though less evident at first, the stimulus's effects on the environment should also be taken into account, since they may have an impact on recipients' spending habits based on how they choose to utilize their income.